We can now go across to correspondent Thameen Al Kheetan standing by in Gaziantep. Thameen, you traveled with the team of doctors to a remote area of Gaziantep yesterday. What exactly did they do?
Well, they are working on an aspect that is very much left behind in this earthquake crisis, which is the everyday medical procedures that are very important for people's lives. You know that hospitals are full with patients who are injured from the earthquakes, so many people who need everyday procedures are left behind. For example, you've got patients who need dialysis, those who have cardiac problems, those who have diabetes, for example, and many other health conditions. These people have no place in hospitals or clinics, so we have met with this group of volunteers from Turkey and France who set up a field hospital in Adiyaman and who go on tours to remote villages to help people with everyday medical procedures that they need. Of course, you know that many people whose homes have been destroyed in the earthquakes in big cities, of course, they left to live with their families and relatives in rural areas, and this creates a huge demand in terms of medical assistance in these areas. There's, of course, there are people who are traumatized by what they have seen in these earthquakes, so these volunteers also offer psychological follow-up on these issues and cases. We have seen scenes of people crying, people hugging each other, hugging the volunteers, because they say that for one moment they feel like somebody cares about them.
And talk us through what diseases risk breaking out given in the aftermath of an earthquake like this.
Of course, the biggest challenge today for Turkey and for Syria is this risk of a wide health crisis erupting in both countries. You know that millions are living today on the streets or in tents. They have no homes, so they have no access to showers, no clean toilets, and sometimes they have no clean drinking water, which makes a risk of cholera outbreak. We know that Syria has recorded a few cases of cholera in the past few months. There is the dust that comes from the rubble, which could lead to respiratory problems, and of course there's this very cold weather. Temperatures during the night could be below freezing point. So that's why the World Health Organization is alerting about a possible wide-scale health crisis in Turkey and in Syria.
Thameen, thank you very much for that. Thameen Al Kheetan reporting there from Gaziantep.